My name is Scott, and Dr. Moffat is my surgeon. Well, it started out as just a typical day. All of a sudden, I had a pain where it stopped me in the middle of a sentence, right at my sternum. It took my breath away to the point where I couldn't talk.
Scott is a healthy guy that arrived at hospital, looked like he was having a heart attack. Fairly sudden onset, chest pain, epigastric pain, sort of just below the breastbone, sweating, lightheaded, looked really unwell.
So we went to the hospital, and I was feeling some pretty severe pain by this time. They thought I was having a heart attack.
Some people will present with gallbladder pain. We call it biliary colic, and it can be so intense that it mimics a heart attack. Scott's problem was twofold. It was stones in the gallbladder and biliary colic, severe colic, which is the cramping pain that he had, and then the blocked bile duct.
The nice thing is that when Dr. Moffat came in, they had already identified what the problem was, and now he was the expert coming in to take care of the problem. There was an extreme confidence that was reassuring, especially when we found out how well Dr. Moffat knew these procedures. Made me feel comfortable, was very thorough about how he would explain the different procedures, what was going to happen, how it was going to happen. Never once made me concerned.
We were able to remove the gallbladder laparoscopically and under the same anesthetic, put the telescope down into the intestine, open the lower end of the bile duct and retrieve that stone. And we were able to, under one anesthetic, deal with both problems. So it's a very efficient way of dealing with complicated gallbladder disease.
Before I had this surgery, there was a lot of times where I was feeling pain and didn't realize at the time that I was having gallstone issues for months ahead of the surgery.
And almost universally, the patients will say, absolutely. They'll say, you know, now that I think back, I've been having indigestion or bloating or maybe some nausea or just don't feel well or food doesn't agree with me all the time. Low-grade symptoms that normally maybe wouldn't trigger anyone to see a doctor.
Dr. Moffat's bedside manner is always very positive. He comes in, he's very calm, very engaging.
You can treat patients like people. You can treat people like family. You get to know the patient, and in unusual or circumstances such as Scott's, here we are, years later, we're still friends.
Yeah, we are so fortunate to have Dr. Moffat right here in our own backyard.